He is the authority, and so it is with pleasure I introduce you to Dr. Anthony Geroulis.
In his public seminars, he's able to really demonstrate on a very personal level the things that can be done and the risk benefits of the procedures, so that these people that come away with some information about whether or not they would actually do this for themselves. I think he's always been on the cutting edge of new technology, and he's an outstanding teacher, and he encourages high technology and excellence in performance.
You're going to do facelifts after this course that will show natural appearances. The patients will look rested. They will not have that pulled and tight look. We will show you all of the latest techniques, and we will show you the instrumentation that you need to get to perform those techniques.
Through the academic credentials, he's shown that he is a leader in the field and continues to be a leader in the field, and I'm sure enhances the knowledge of almost everyone that comes to these courses. Some of the ratings of the courses that he has given here are some of the highest that have been obtained in the university systems, courses that have been given by the University of Chicago.
Well, courses of this quality are really not readily available. Certainly not in Australia, and not in really many places in the States. So having been to a previous course with Dr. Geroulis, this opportunity to have another one was just had to come. He's an excellent surgeon, great enthusiast, great teacher.
You okay?
I would come to Chicago to have Dr. Geroulis do my surgery, because I think he's a scientist, he's an excellent surgeon, but more importantly, he's very passionate about patient advocacy. The patients are always number one, and that's very important, regardless of the field of medicine that we're in, and that I hold in very high regard.
So now we're going to move to the other side.
By observing Dr. Geroulis in surgery, and also by seeing the patients that he brings in after surgery to look at their results, we can tell that they are superior results. And when you have those kind of results, they usually come from people who are the leaders in the field, because they know what to do, when to do it, and how to do it to get those kind of results.
Well, I think he popularized and was a scientist in corrective surgery, which we call an eyelid lift, particularly for people who have bags under their eyes. But what was important, he was able to bring to our new knowledge base on how to do this surgery from inside the eyelid, so there'd be no scars that are visible. And the fat could be removed successfully, and in a very, we call minimally invasive operation. So I think he's probably best known for that, because he was certainly a pioneer, and he has taught many people how to do the procedure.
This is Chicago's very own WGN News at 9.
Cosmetic surgery was once performed only on movie stars or the rich, and for the most part, the recipients were women.
But today, prices have dropped and the times have changed. Men are going under the knife almost as often as women. WGN's Robert Jordan joins us tonight with a procedure that's changing many lives, right?
That's right, Stephen Allison. The possibility of facial scars from removing bags under the eyes has kept a whole segment of the population from having cosmetic surgery. The more color you have in your skin, the more likely you are to show surgical scars that may leave a thin white line as the wound heals. But now, surgeons armed with new techniques are helping patients unpack their bags for good.
Under eye bags, either you have them or someone you know does. Cosmetic or plastic surgeons have been removing bags for years, but for the most part, only white women have historically had the operation. Dark or brown-skinned Greek, Italian, Hispanic, or African-American people with bags have been afraid of the surgery for fear of scarring, but not anymore.
Over the next 2 days, you are going to be exposed to many revolutionary techniques in cosmetic surgery, which is removing the bags from the lower eyes with no visible scars.
Dr. Anthony Geroulis is teaching this surgical procedure at the University of Chicago to other doctors from all over the country. The operation has become very popular now that almost anyone can have it.
I have dark circles anyway, but with my eyes being deep set, they always looked bad. People would say to me all the time, "Gee, you look so tired."
Of course, I was afraid of scarring.
And with this procedure,
I
Both
understand.
inside.
Right, I understand that all of the work is done behind the lid so that there is no visible scarring.
The surgery today is being done as a teaching tool at the U of C. Geroulis normally does the procedure in his Wilmette office.
On the lower lid, I'm going to administer the local anesthesia through the lower lid, protecting the eye at all times. After it has time to take effect, I'm then going to make an incision using either a cutting cautery or the laser. And I make that incision through the conjunctivum.
Through the inside, the pink part of the lower lid, not the outside. Once the incision is made, Geroulis begins to carefully cut out the fat using a tool that emits an electric current so that there is no bleeding.
But by taking out this fat, again, you'll continue the sculpting process on this lady and getting her that look that she's desirous of.
The procedure allowed me to do something that I've wanted done all my life. Recognize that guy? That's me, just about 4 months ago. Look at the size of those bags under my eyes. Here, let's take another view. Look at that one, or that one. Look at how large they are. Now, with the old procedure, I would have been cut under the eye, and that could have left scarring in the front. But with this procedure going inside the eye, there is no scarring. And just 4 months later, tremendous difference.
If they're looking like they partied all weekend on Monday and they really just sat at home and rested, okay? Those are the candidates for this type of eyelid surgery.
Well, that lower lid surgery takes about 20 to 30 minutes, and patients go home the same morning. And they have to sleep, though, at a 45-degree angle for a few days, and then they're back to work in less than a week.
Bob, I know a lot of folks, you look great, by the way. I know a lot of folks are wondering whether insurance pays for the operation and how much it costs.
Insurance does not pay for it because it's considered cosmetic surgery. So the idea is to find someone that you know has a good track record. Geroulis is one.
Okay, silly. Is there any chance that the bags will come back?
No, they don't, because just like liposuction, once the fat cells are
It's
removed,